Great. All right. So welcome. This is the Board of Health meeting for Thursday, August 25th. Please rise to salute the flag. Pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, liberty and justice for all. So again, good evening and welcome to the August meeting of the Revere Board of Health. My name is Dr. Drew Bunker, Chair of the Revere Board of Health. Joining me for tonight's meeting are Board Member Craig Costanza, Board Member Neza Loadi. For tonight's meeting, our City of Revere staff, Lauren Buck, who's Director of Public Health, Michael Wells, Director of Municipal Inspections, Health Agent, and Paula Supolavida, the Board of Health Clerk. Tonight's agenda, we're going to start with the National Suicide Prevention Week proclamation. So the City of Revere has designated the September 4th to the 10th of 2022 as National Suicide Prevention Week. And I'm just going to go ahead and read this proclamation. Whereas suicide is the 12th leading cause of death in the United States, the third leading cause of death among children and teens between 10 and 19, and the second leading cause of death among individuals between the ages of 20 to 34. Whereas it is estimated that in 2020, there were 1.2 million suicide attempts. Suicide was the 15th leading cause of death in Massachusetts, based on the Centers for Disease Control. 618 people died by suicide in Massachusetts and over 45,000 across the United States, per numbers from the Centers for Disease Control. Whereas over 90% of people who die by suicide have a diagnosable and treatable mental health condition, although often that condition was not recognized or treated. Whereas organizations such as the American Foundation for Suicide Prevention are dedicated to saving lives and bringing hope to those affected by suicide through research, education, advocacy, and resources for those who have lost someone to suicide or who struggle, and urge that we, 1, recognize suicide as a preventable national and state public health problem and declare suicide prevention to be a priority. 2, acknowledge that no single suicide prevention program or effort will be appropriate for all populations or communities. 3, address the disparity in access to mental health care for underserved and underrepresented groups and advocate for ending these disparities. 4, fund new research to support culturally informed and evidence-based mental health care and services. Encourage initiatives based on the goals contained in the National Strategy for Suicide Prevention and the 2022 Massachusetts Suicide Prevention Plan. Promote awareness that there is no single cause for suicide, and that suicide most often occurs when stressors exceed the coping abilities of someone struggling with a mental health condition. 6, develop and implement strategies to improve and increase access to quality mental health, substance abuse, and suicide prevention services and programs. Number 7, continue advocacy to ensure we can reimagine a comprehensive suicide and mental health and substance use crisis response system that builds on the historic new 988 number for the Suicide and Crisis Lifeline. Now, therefore, be it resolved that, should I say it? So I'm just going to read this from the mayor's perspective, but therefore be it resolved that I, Brian Arrigo, Mayor of Revere, do hereby designate September 4th to the 10th, 2022 as National Suicide Prevention Week in the City of Revere. The proclamation is issued in the Executive Chamber of the City of Revere this 25th day of August in the year of our Lord, 2022, and of the independence of the United States of America, the 246th. All right, next is we're just going to review and approve the minutes from July 28th, 2022, the meeting from then. Do other board members approve of the minutes?
I approve the minutes.
I approve.
Great, thank you. Next is the Public Health Communicable Monthly Report from Lauren Buck.
Thank you. All right, so I'm going to give you a report on non-COVID communicables first, as I usually do. The one kind of bullet point that I want to highlight is our monkeypox cases. In the last month, we had 3 confirmed and 1 probable. I just want to talk a little bit more about monkeypox. On May 18th, the Massachusetts Department of Public Health reported the first case of monkeypox in a Massachusetts residence. Additional cases have been identified in Massachusetts since then. Obviously, there are thousands of cases nationally and globally, and the last that I checked, the Massachusetts number was around 200. While many of the identified cases are within networks of self-identified gay and bisexual men, other men who have sex with men, and transgender individuals who have sex with men, people of any sexual orientation or gender identity can become infected and spread monkeypox. That's very important. Monkeypox is a rare viral illness with an incubation period of about 21 days. Illness may begin with flu-like symptoms, chills, fever, headache, muscle aches, and swelling of the lymph nodes, and usually progresses to a rash that looks like pimples or blisters that appear on the face, mouth, or other parts of the body. Most infections last about 2 to 4 weeks, and people are considered infectious throughout the duration of symptoms. The virus is unlike COVID, and so it does not spread easily between people. Transmission most frequently occurs through direct contact with monkeypox, rash, lesions, scabs, or bodily fluids. The virus can also spread through contact with fomites, which are just items that are touched, items that touch the rash, lesion, or bodily fluids, or through large respiratory droplets through very prolonged face-to-face contact. So transmission is much different than COVID. Our cases are still relatively low, and we continue to monitor here in Revere. Our update about COVID. As of August 23rd, 2022, we had 24,591 total confirmed and probable cases. Our daily average case count is at 16. Our 14-day positivity rate is at 11.4. Unfortunately, this is climbing a little bit. It's a trend that we're seeing not just in Revere, but other municipalities throughout the region, that our positivity rate is not, unfortunately, declining, but plateauing or even rising a little bit. Our total deceased is 188. Just a couple other notes since we last met about some other COVID updates. Since we last met, Novavax has been approved as a use of, Novavax is another brand of COVID vaccination. So now there are a total of 4 manufacturers making COVID vaccines: Pfizer, Moderna, Johnson & Johnson, and Novavax. It was approved as another primary series option for adolescents ages 12 through 17, and for those over 18. And the other update that I want to make is, as of Thursday, August 11th, the CDC issued revised guidance related to COVID isolation and quarantine. Updated guidance includes recommending that exposed individuals no longer need to quarantine for 5 days, but instead wear a high-quality mask for 10 days after exposure. And the other updates to the guidance can be found on the CDC's COVID-19 webpage. Thanks.
Great, thank you. Next is going to be Inspectional Services Monthly Report from Michael Wells.
Thanks, Dr. Bunker. We had a pretty busy month at Inspectional Services this month. On the Interior Housing Division, we issued 56 certificates of fitness. We did 7 re-inspections on those certificate of fitnesses. We had 25 interior complaints from residents. We had 6 re-inspections for interior complaints. We had 2 pool inspections, 3 re-inspections on pools, and 5 lodging house inspections. On the Food Inspection Division, we conducted 33 routine inspections of restaurants. We had 20 re-inspections, 1 complaint inspection, 5 pre-opening inspections, and a total of 7 temporary food license inspections. On the Exterior Sanitation Division, for violations, we had 49 accumulation of litter and garbage violations issued, 2 carts out at improper times, 1 commercial vehicle in a residential neighborhood violation, 46 improper bulky item placements, 261 improper placements of garbage and trash, 2 improper signage, which is yard sales on public property, We had 6 improper storage of garbage and trash, 14 junk heaps, 54 unclean, unsanitary, that also incorporates overgrowth, which is the time of year. 3 unpermitted dumpsters and compactors. And we issued 5 violations this month for work happening on a property without a permit. That concludes the inspectional services report.
Great, thank you, Michael. Next, we're going to finalize and vote on proposed amendments to regulation restricting the sale of tobacco and vape products.
Okay, great. If I could just direct the board's attention to the regulations that are in front of you. The regulations that are in front of you reflect the changes that were made according to my notes, Bonnie Carroll's notes, Lisa Stevens-Goodnight notes from last meeting. We all looked through the draft regulations, updated with what we talked about last month. And before you, we believe that these reflect everything that we talked about last month and all the changes that were made. Sorry. I'm going to bring your attention to just several parts of this, not the whole thing, that I just want to make sure that we review again. The first thing is on page 4. I just want to remind everyone that we put in the definition of blunt wrap as a tobacco product. This is a change from our previous regulations. Just wanted to highlight that again, so that is included. On page 6, just another reminder that rolling papers were also included in this regulation. That is a change from last time. Again, these are not the only changes that were made, just some of the important ones that I want to make sure that we all review again. And then if we can all go to page 9. So again, just a reminder for everyone on the board, number 11, maximum number of tobacco product sales permits. This was a big change that we made. As you can see, Section 11, Part A states, as of the effective date of this regulation, any permit surrendered, revoked, or not renewed, either because a retailer no longer sells tobacco products as defined herein, or because a retailer closes the retail business, shall be returned to the Revere Board of Health and shall be permanently retired by the Board of Health, and the total allowable number of tobacco sales permits shall be reduced by the number of the retired permits. Again, this is the section that you all decided to put in the, I believe it's called an advanced cap, which means that our total number of permits will always be decreasing from here on out if the existing permits are surrendered for the reasons listed in Part A. Part B, just a reminder that of the permits allowed pursuant to Section 11A above, there shall be no more than 2 tobacco product sales permits issued to adult-only retail stores as defined above. That's not a change from previous regulations, but just an important thing to highlight. Section C is this regulation that the tobacco product sales permits shall not be issued to any new applicant for a retail location within 500 feet of a public or private elementary or secondary school. And that's what I really wanted to highlight from that section. If the board notices any discrepancies with what we talked about last time, we can talk about that before we vote. And then the final part that I wanted to highlight was on page 13, which is just the violation section. Again, I just want to go over for clarity for the entire board. So violations, and it's section S, and I'm going to jump down to part A. So again, this is for violations of the sections of the regulation that incorporate MGL Chapter 270, Section 6 and 105, which is really about sale to an underage person. In the case of the first violation, we are now codifying that, or putting into regulations. I'm not sure if I should use the word codifying. In the case of the first violation, the fine of $1,000 shall be issued and the permit shall be suspended for 3 consecutive business days. Part B, a fine of $2,000 shall be issued and the tobacco product sales permit shall be suspended for 7 consecutive business days. Okay, so in Part B, you'll notice that there's a shall/may. I believe that's an error that we need to take out the /may. Yeah, that shouldn't be included. And then in Part C, in the case of 3 or more violations within 36-month period, a fine of $5,000 shall be issued, and the tobacco sales permit /may be suspended for 30 or 60. Again, before you actually sign these regulations, we will need to take out the /may for both B and C. Sorry, we should have caught that before we brought them to you. So again, if you confirm that you want the /may being taken out of those 2 sections, we can do that and have you vote on them next month. Or we can have you vote on the fact that those will be taken out and everything else is fine, and then we will bring you the edited version next month for you to actually sign. But you can still vote tonight.
That sounds like a good plan. I think the shall, I think, is what we had decided upon last meeting. So if that can be reflected in what we sign, but I think we can agree on that. Excellent. Okay. So, we went through it extensively last meeting, and I think my viewpoint is that decisions we made were the right ones. I feel comfortable with the regulations as they are now. So I vote yes to what's enclosed in the regulations for the restricting the sale of tobacco products.
Yeah, I second that. I approve all the regulations.
And I vote yes as well.
I vote yes.
Okay, great. So we will get the regulations with those 2 edits taken out. Again, that's just taking out the /may for those 2 sections, and we will have you sign them next month. Thank you.
Great. The next is the licensing. I'm going to hand that over to Lauren. Licensing next.
Okay, so we have 2 licenses for your approval. The first is a body art individual practitioner application, which was submitted by Blanca E. Soto Lenis. The submission date was July 26th. The inspection date was August 22nd, and the result of the inspection was that it passed. We recommend, the Public Health Department and the Inspectional Department recommend that you approve the license for the individual practitioner.
Yes, I approve.
Yes, I approve the license.
I approve.
Great, and the second one is the establishment permit for the same submitter for her establishment of Lakshmi Beauty Incorporated. Her submission date was July 27th. Her inspection date was August 22nd. She also passed that inspection, so the Public Health Department and the Inspectional Department recommend that you approve her establishment license as well.
Yes, I approve.
Yes, I approve the license as well.
And I approve as well.
Great. So that's going to conclude our meeting for today. Thank you, everyone. We'll see you next month.
Meeting to adjourn?
Thank you, everyone. Good night.